If you have a strong family history of cancer, there are multiple individuals on one side of the family or the other that are affected. People have gotten cancers at young ages, and there just seems to be a pattern. It's a really good idea to consider getting tested to see if you could carry a gene mutation that could also put you at increased risk of developing those types of cancers at some point in your life. There are many reasons to do this. When people find out that they carry one of these gene mutations that increases the risk of cancer, they're called previvors. They don't themselves have the cancer, but they should undergo increased surveillance and screening so that cancer can be caught early if they have it. And that leads to early intervention, increased survival rates, and it also allows for prevention, such as having risk-reducing surgery. A major example of this that I see commonly in my practice as a fertility expert is the BRCA1 and 2 mutations. The BRCA mutations can predispose individuals to breast and or ovarian cancer. And I would say that there are 3 major reasons to consider fertility preservation for these individuals or these previvors. One is, God forbid, if you do realize the risk of developing cancer, either breast or cancer of the ovaries, requiring chemotherapy or surgery, this is going to impair your fertility in an irreversible manner, and it will be so helpful that you've already taken this step to preserve your fertility for the future. You also may want to do something called risk-reducing surgery, and this may mean removal of the ovaries at a certain point in your life to reduce the risk of developing ovarian cancer. And if you've already frozen your eggs or frozen embryos, then you've preserved your fertility regardless. The third reason is one that people think about less, but it's so important. You have the opportunity, by using IVF and genetic testing of embryos, to select embryos that don't have the mutation and to avoid passing this on to future generations. Because if you carry these types of mutations, 50% of your children could also carry the mutation. And so this is another application. And actually there's a 4th bonus reason why it may make sense to consider egg freezing or embryo freezing if you've been diagnosed with a genetic mutation like BRCA1. So the BRCA1 mutation in particular has been found to be associated with an accelerated loss of eggs. There was one study that showed 25% lower AMH levels in patients who carried the BRCA1 mutation versus age-matched controls who were non-carriers. So it is yet another reason to consider being more proactive to utilize and access and freeze the eggs that you have available while you have them. I'm making this video in front of an amazing piece of art that was actually created for me by one of my patients who herself is a previvor. She's a carrier of the BRCA1 and 2 mutations and is undergoing egg freezing for all of the reasons that I explained in this video. So this post is really inspired by her and all of her work that she does in advocating for previvors and raising awareness of these important issues. I love it because sometimes it looks like eggs to me and other times it looks like boobs. What do you see? But I do hope that this video was helpful, and if you look at your family history and think to yourself, there could be a pattern, this is a sign that you should talk to your doctor and consider getting tested, because knowledge is power. And only once you know about it can you make use of the options and the technology available.